As if we didn't have enough to worry about, there is also a growing concern about the Delta variant of the coronavirus. Cases of this more contagious Delta variant have doubled within just the past 2 weeks.
Joining us right now to talk more about this is clinical nurse specialist Alice Benjamin. Alice, as always, welcome.
Thank you for having me.
You work in the ER. What are you seeing in the hospital right now?
You know, one of the things I want people to understand is that I believe that the worst is behind us with the COVID pandemic, because what we're seeing in the ER is we're seeing more of the traditional things that we saw pre-pandemic: heart attacks, strokes, aches and pains, broken arms, and those type of things. Very rarely now are we seeing people symptomatic with COVID-19 coming to the emergency room. And that's what we're seeing right now. But that may change as we're looking at this Delta virus that is growing in our communities.
You know, a lot of people think, okay, a variant, that means the coronavirus is going to come back around and hit us again. If you are fully vaccinated, is that a concern?
Well, you know, there are different strains and variants out there. Every time the virus is allowed to spread, it can mutate because it's trying to survive. Now, our biggest concern is that there's going to be a particular strain that's going to stick and cause devastation, is going to learn how to work around our current vaccine. So I want people to be rest assured that if you are currently fully vaccinated, you are more than likely well protected against any of the various strains that are out there. However, with this Delta strain that we are seeing now doubling almost every week now, you know, that is a strain that we are particularly concerned about because it is almost 60% more contagious than the original strain, as well as the UK strain. And it's been shown anywhere from 30 to 70% more likely to cause a more severe illness, which can result in death. So we get really concerned when we have strains like this out there.
Nurse Alice, what about young children? Hypothetically, let's say you have a 5 or a 7-year-old. You may be invited to a family gathering or something. Parents, all the adults are vaccinated. What do you do with a young child? Should you leave that child at home? Should you bring them, mask up? What should you do here?
So I've never really been one to be an alarmist, but with the growing information around the Delta strain, I really want to emphasize that we need to take some caution with our people who are unvaccinated, especially our young children who are not yet eligible. So in those cases, I would definitely recommend to any parent, and myself being one as well, if you have someone who's not vaccinated, to please make sure that they are wearing masks, that they are social distancing, and very well, as much as possible, try to keep them away from unvaccinated people. We know children are very resilient. They've, you know, very low on the totem pole as far as previous admissions, previous deaths, but the Delta strain is proving and showing us that more children are getting infected. And with our concern of that is if more children are going to get infected, it's more likely that they can also get very sick. And we don't want our children to die from COVID-19, which is something that is preventable.
All right, Nurse Alice, as always, thank you for your time. We appreciate it.
Thank you. Sure.
Well, there is a search underway